Hello?
Hi, Dr. Goodwin.
Hi, how are you today?
I'm doing well. How are you?
Okay, I guess you're up at the Alzheimer's Association meeting?
I am. I'm in Toronto at the Alzheimer's Association's International Conference this week.
Okay, that's good, and I'm glad to have an opportunity to talk with you and our Health Power audience.
Thank you for having me.
Right, and what I would want to say, first of all, is that you're the chief science officer?
I'm the Senior Director of Medical and Scientific Operations.
Senior Director of Medical and Scientific Operations at the Alzheimer's Association.
Mm-hmm.
So you can tell us what's going on at the conference. What's the latest new information that you've learned?
We've seen some studies that are looking at our jobs and the complexity of our jobs, so the way that we interact with data, but also the way that we interact with people, and that by combining complex thinking with social interaction, it seems to allow us to withstand some of the brain changes that all of us have as we age, but also possibly some of the brain changes that we have associated with dementia. Our brains are a muscle, so it makes sense that we need to continue to exercise our brain for overall good health.
Is this when you talk about the social interaction, are you speaking of the way caregivers interact with individuals who have Alzheimer's, or the way caregivers interact with each other, or the way doctors interact? Could you just elaborate on that some?
Absolutely. So these studies were looking at an individual's occupation or their job, so as they engage with other people, but also in the complex thinking. So like a teacher or a counselor, individuals that had some component of mentoring as part of their job seem to be the most beneficial in the long term.
Does that seem to increase or decrease the risk of developing Alzheimer's?
They really looked at some of the brain changes, overall memory as we age, and it seemed to be beneficial. There was one study that suggested it could also possibly be able to withstand some of the insults, if you will, that we all have, and including that associated with vascular dementia or our overall cardiovascular health.
Right. And so what does that say? That people might want to think more about selecting careers and occupations that have more social interaction associated with them?
I think we think about it more as what are some of the lifestyle behaviors that we can all incorporate or continue or grow or expand in our current lives. Thinking about social interaction, thinking about how can we engage in activities of complex thinking. So what can we do to use our brains, continuing to learn new things? What can we do to be socially active? Can we volunteer in our community? Can we participate in a class? A ballroom dancing class, for instance, where we're socially active, we're engaging our brain in how we learn the dance, and then we're also physically active, which also has been shown to be beneficial.
Okay, and so essentially, and is that more important as a person ages?
It seems to be beneficial throughout your life, although many studies have suggested, and these in particular studies suggest that our occupation throughout our life, and as well as our formal education throughout life, may be protective in the long run.
Okay, and is there anything that one could do from a detection standpoint to possibly decrease the impact of Alzheimer's?
I would say if you're worried about yourself or a loved one and you see changes in memory, and actually one study that we're seeing presented here is looking to actually measure the changes in behavior, personality changes that our loved one may be demonstrating earlier, and looking to actually measure that in a tool, a simple tool that would be able to be administered in a healthcare professional's office. If you see those types of changes, you should speak to your healthcare provider for more information.
Okay, and where in general can people get more information about these studies that are being reported at the conference?
You can go to alz.org or call our 24-hour helpline at 272.
Slow down. Wait a minute. 1-800.
272
272
3900.
3900. Let me repeat that. One can go to www.alz.org or 1-800-272-3900.
Yes.
Okay, and the bottom line of the key thing that's being reported and talked about is the importance of social interaction and even occupation and careers, as they might decrease the risk of Alzheimer's.
Continuing to use your brain and stay socially active.
Let me try that. Use your brain. Continue to use your brain, right?
Continue to use your brain.
Okay, and the other thing you just said?
And to stay socially active.
Stay socially active. Those are very good suggestions, and I will. I'm jotting those down so that we can emphasize those.
Wonderful.
I hope to write something on the website about this, and I may be back in touch with you as I do so.
Absolutely. Feel free to reach out to the Alzheimer's Association.
Okay. Thanks a lot.
Thank you.
Have a good day.
You too.
And enjoy the rest of the conference.
Thank you so much.